My name's Sam, I'm a Psych NP, and something I always encourage new grad Psych NPs to do is set the communication expectations very early with patients, especially regarding calls and the patient portal. Because if you don't set those boundaries early, the patients are going to set them for you, and of course they're going to choose unlimited access and quick, fast replies. And in a perfect world, that would be possible, but that's not what the patient portal is for, and it's a recipe for burnout. Very early on, I explained to patients, and I think at my company, they also sign a consent saying what the expectations are for the portal, and it's not an emergency. So if there's anything urgent or emergent, they need to call the office because the portal is not for urgent matters. So don't expect a response back immediately, even the same day, on weekends, after hours, things like that. And what things are appropriate to talk about over the portal and what things aren't. I've had patients message me 4 times in one day before I even had a chance to respond once, or wanting to basically not have an appointment and just talk via the portal, and I would not recommend that. And I know this sounds mean and unnatural, but if you don't set those lines, the boundaries, they're gonna get blurred. It's a recipe for burnout for you, and it's just not sustainable. For the patient, you are their only provider, and you probably have hundreds of patients. And like I said, I've had some patients message me 4 or 5 times in one day. So if you multiply that by 50, 60, 100 patients, that's a lot of messages. That takes up a lot of time, and that's time away from seeing patients, or it's unpaid clinical labor. And again, it's not to be mean to patients, but essentially you are helping them build boundaries, tolerate distress, recognize what's urgent, not urgent, and know what requires an appointment and what doesn't. And the company you work for also needs to be very supportive and tell clients, make them sign consent saying the portal, and we are not an emergency room, so after hours, anything that's an emergency should not be communicated through the portal, and you need to go to your nearest emergency room or give them the safety line. You need to have a clear policy in place also to protect yourself.